So good evening, doctors and all the participants. I Shuman on behalf of Shield Healthcare. Welcome you all in today's another interesting and important topic, that is menopause and quality of life. And today's our guest speaker is Professor Dr. Asian Goswami sir. Although sir doesn't need any kind of introduction, but it's my responsibility to introduce sir. Sir is the ex-professor and head of the Department of Obstetrics and Gynecology, Guwahati Medical College, and sir was the ex-PG teacher, DNB, Nazareth Hospital, and ex-president of Guwahati Obstetrics and Gynecology Society. So in the short introduction, I request sir to take over the session, and meanwhile I request all the participants, doctors, please post your queries on the QA dashboard of the Shield Connect page. So once the talk will be over, we shall have a short discussion on this topic with sir. So thank you very much sir for your valuable time in our Shield Connect platform, and over to you sir for further proceedings. Thank you very much.
Thank you for your kind introduction. Now, today we will discuss on menopause and quality of life. Now, menopause is an important part in the woman's life, and it may, in some women, it may pass off very peacefully. In some women, it may have certain problems, and in some women, there may be so much of problem that may hamper the quality of life, and there may be various different problems. As we proceed, we will go on discussing this point. Now, there are various treatment for remedy of the menopausal problems, starting from hormonal, non-hormonal therapies, and some changes in the lifestyle practices. Now, we'll be particularly stressing on the menopause and quality of life, particularly non-hormonal type of management, and also the lifestyle changes. So, next slide, please. Now, menopause is as you know, menopause is the permanent cessation of menstruation. Actually, the meno means mens and pause means cessation. It's a Greek word, and from that word, this definition has come. Now, this permanent stoppage of menstruation is as a result of declining ovarian function, leading to deficient ovarian hormonal production. So that is why there will be, because of the deficiency or irregularity or diminution of the hormone production, there will be this perimenopausal and menopausal symptoms. Next slide. Now, this in the different, you know that there are different stages of life, the teen years, then fertile years. So 10 years before 20, there's a fertile years from 20, that is up to they say 40, 45, and then from perimenopause starts from 40, and menopause in the 50s, that is the 50 to 60 years of age. So again, if we think, we'll find that after menopause, about 30 to 50 years will be their lifespan in the woman's life, and we will be concerned how to manage this long period of life after menopause. Next slide. Now, this is by definition, it is strictly the stoppage of menstruation, and when there is stoppage of menstruation for 1 year continuously, then we say it is menopause, and it is a hypoestrogenic state. So there will be no endometrial proliferation, no growth of the endometrium, no shedding of the endometrium, and that is why there will be no period. So, and as there is diminution of the ovarian hormone, the FSH will rise, and it will become more than 40. And the average age of menopause is 51 to 52 years. Next slide, please. Now, perimenopause is the period that is before the menopause. There will be symptoms. They may develop symptoms before the menopause, say maybe from 35 years or 40 years. They may develop certain symptoms because of the fluctuations in the hormonal level or diminution of the hormonal level, leading to some irregularities in the cycle, or there may be vasomotor symptoms also even before the actual menopause. This is mainly because of the fluctuating estrogen and unreliable progesterone levels. Next slide. Now, if we go to the endocrinology of menopause, so in this menopause, there is actually the depletion of the ovarian follicles. So when the ovarian follicles are depleted, there will be degeneration of the granulosa and theca cells, and that is why there will be this, they will fail to respond to GnRH, and that will lead to lower estrogen, fall in estrogen level. There will be decrease in the negative feedback mechanism to the hypothalamo-pituitary axis, and consequently there will be rise in GnRH attempting to stimulate the ovaries. Next slide. Now, this process begins 5 years before the actual period. LH and progesterone level remain unchanged initially, but so indicating that cycle probably continue to be ovulatory till proper this menopause starts. But there may be hot flushes because of the fluctuation on the estradiol level. Next. Now, in contrast to follicular cells, the stromal cells, they will continue to produce the androgens in response to LH after menopause. So the adrenals also will continue to produce androgen. That is why the estrogen and androgen ratio will be changing, and there will be increase in the facial hair growth after menopause. So more androgen level. But in case of this, in this obese women, the androgens are converted in the peripheral body fat to weak estrogen estrone. That is why they are less prone to menopausal symptoms and osteoporosis, but there may be increased chance of endometrial cancer and malignancy. Next slide. The importance is that for a long period of 30 to 50 years, the women will have some uncomfortable symptoms in the menopause. Many of the women will have, and this may be so much in some of the patients that it may disrupt their normal lifestyle. So normal life functioning may be disrupted. So possible increase, there will be increase in the mood changes, sadness, lack of concentration, and there will be melancholia. Different changes may be there, and which may cause very much disturbance in their quality of life. And there may be sometimes even abnormal breathing and decline in the general health, and there will be a huge impact on the reproductive system. Next slide. So if we see the Indian women's attitude towards menopause, it is a bit different than the Western population, because some of the Indian women, they welcome menopause because they feel they are free from the monthly bleeding, and that is why they are free, and there is no risk of pregnancy. That is their freedom. They can freely participate in the religious and social activities. So they feel that it is a better thing. And also, psychological symptoms are comparatively fewer in the Indian women, particularly rural population, because they have a joint family, and they have a very strong familial support. So lifestyle in rural India, so they are having more physical activities, more fiber containing diet, and low fat, and they have good intake of meal, and this exposure to sun is very much. So they are having less hot flushes. Although there are hot flushes, it is more common in Caucasian women. In Indian women, hot flushes are less comparatively. But urinary symptoms are common in Indian women. And Indian women, they feel shy to discuss about sex and libido. So that is why fewer patients complain about this. Although gradually there are these educated and well-to-do families, they are concerned, and they are coming to us with these symptoms. Next slide. Now, in the menopause have lot of impacts, and it may have short-term effects, and also long-term effects. Now, short-term effects include the hot flushes, which is the most disturbing in many women, even night sweats, sleeplessness, fatigue, mental lapses. They may have mood changes, irritability, palpitation, headache. Then all this, they may have very much disturbance in their life, and they feel very unhappy, those who are having these symptoms. Next slide. Now, there may be long-term effects, which are also we are concerned, because there may be dryness and atrophy of the vagina, the cognitive decline because of the effect on the brain. Then in the bone, there will be loss of mineral density, blood vessel atherosclerosis may be more, skin wrinkling may be though, mucous membrane becomes dry, genitalia atrophies, and there is loss of libido, joint pain and tightness, metabolic disturbances, and macular degeneration. So there will be a lot of long-term effects may be there. Now these impacts do not fade, rather they may get worse. Next slide. So they will need our support to improve the quality of life. And now how do we define quality of life? Now quality of life index is actually at the interplay among the social, health, economic and environmental conditions which affect the human and social development. Next slide. Now there are so the quality of life index is important because for the community development, which can be used as to monitor the key events that encompasses the social health, environmental and economic dimensions of the quality of life. So menopause is one of the key events. Next slide, please. So menopause is one of the physiological events because these they affect the human physiology and also psychology during the entire lifespan this in the menopausal period of the woman. So that is why it is a key point in the important point in the quality of life index. So menopause must be they must be managed very properly so that we can give a quality of life to the menopausal women. Next slide. Now, there are different factors which affect the menopause. Now, there are some certain universal issues are there, like demographic sense, social and economic and social security, nutrition, safe environment, educational access to education, life skill development, awareness, life expectancy, disease burden. So women rises. A lot of factors may affect the menopausal life. Next. Now, our aim is how to maintain a quality of life. There are various options are there. So one is this natural option. So to have a healthy lifestyle. So to have a healthy lifestyle is a natural option. There is no medication and nothing in it. But there may be some alternative treatment may be necessary sometimes in the form of supplements, some vitamins, then naturopathic drug or homeopathic remedies. Patient may also need medical treatments because to treat some specific problems or problems with medications as they arise. So they may need some medications also as and when necessary. Now they may need also in some of the patients, they may need hormonal treatment because we have to replace the original substance that is missing, the estrogen hormone for preventing the prevention of the menopausal symptom as well as treatment of menopausal symptoms. Next slide. Now, before we give any treatment or hormonal or natural treatment, we must evaluate the patient properly because all patients are not same and all patients will not need the same treatment. So we will have to individualize each of the patient, and for that we must have a detailed personal and family history of the patient, proper physical examination including height, weight, blood pressure, because blood pressure is one of the important factors in this because they may have high rise in blood pressure, and then atherosclerotic problem may be there. So we must examine the breast properly because breast carcinoma is also one of the important factors that must be considered. Proper pelvic examination and pap smear to detect early cancer cervix. Now, evaluation of symptoms are needed, and so that we can decide whether there is need for any medication or not. So there may be evaluation of individual risks versus benefit from treatment. Not only we must think, so what treatment will give, what is the risk of the patient and what benefit they will get from the treatment. So routine clinic tests of blood, urine analysis, blood sugar, renal function test, liver function test, the lipid profile, and severe risk assessment must be done thoroughly in all the patients before we go for treatment. Next slide. Now, there will be some patients who will need hormone replacement therapy. So hormone replacement therapy is a very big problem, and it may be different for different person depending on their symptom and whether they are having their uterus or uterus is removed So depending on that, we'll have to go for treatment. Now, grossly, if we see, if the patient is having the uterus is intact, in those cases, we should go estrogen plus progesterone, both progesterone is combined tablet. If the uterus has been removed, then in those cases, only estrogen alone we will have to give. And for vaginal dryness or vaginal problem, we can go for vaginal estrogen in some cases, and in some cases only vaginal lubricant. Now, its indication of HRT is there because we have to give HRT in some of the patients, although not all. So that will give relief for menopausal symptoms, and that will also prevent osteoporosis to a certain extent, and to maintain the quality life in menopausal years. So a specific group of women to whom HRT should be given are premature ovarian failure. Those patients will need definitely HRT, gonadal genesis, they will need. And whenever there is sudden, that means surgical removal or radiation menopause, this patient may definitely need this HRT. Next slide. Now, there are this impact of cosmetic changes in HRT. So if we give HRT, that will improve the vasomotor stability, that is very reducing the hot flashes. So they become very much relief after the hot flashes are relieved. Now, it will also help to maintain the elasticity of skin and tissue. So it will improve the sleep pattern, it will decrease the fatigue, increase the sense of well-being, and they will have a better memory, better recall. That is, they can remember things better, and problem-solving qualities become improved. Next slide. So there are various impact on other health issues also, but we must consider all these cardiovascular disease, osteoporosis, endometrial cancer, all these diabetes, ovarian cancer, everything must be considered thoroughly, evaluated thoroughly before we go for HRT, because HRT has got some effect. Particularly, we are concerned about breast cancer and endometrial cancer. Next slide. So when we go for systemic oral HRT, so HRT we may give in different way. The oral HRT we may give a combined cyclical HRT. So you can use it in perimenopause. They will have monthly durability. Now we may go for continuous combined contraceptive tablet or the estrogen progesterone combination. So if you use it, women is this more than 1 year after the last period, but they will not have any bleeding. If bleeding beyond 3 to 6 months, they will need further investigation. Unopposed estrogen only used if there is no uterus. So if uterus is removed, in those cases only estrogen we give. There no need of giving progesterone. Next slide, please. Besides hormone replacement therapy, in the menopause, maintaining the quality of life in menopause, we should consider certain other supplementation, particularly the calcium, which is an important thing to prevent osteoporosis and improve the bone mineral deficiency, calcium, vitamin D3. Along with there, some of them may need biphosphonates like alendronate or zoledronic acid, they may need. And even nowadays, some are using, say, recombinant parathyroid hormone. So complementary alternative therapy, herbal therapy also may be tried whenever patient is not for hormone therapy. Some patients are not fit for hormone therapy. Those cases we may go for complementary alternative therapy, herbal medicine, or patient refuses hormone therapy. Then also we may go for herbal therapy. Then this medicine, herbal medicine prescribed, and they may give very good results. Next slide. Now, so holistic approach for this lifestyle management is so lifestyle changes and personal habits. So those are very important holistic approach for management of these menopausal problems. So exercise. So exercise is one of the very important things, and we recommend to almost all women if they can do it, and at least there should be 40 to 60 minutes of walking, preferably brisk walking, at least 5 times a week. should be done. And physical workout is also important, like weight bearing exercises for limbs and back or limbs and back strengthening. So this can be done. Yoga and meditation. These two are very important to calm, to cool the mind, as also to feel relaxed and to diminish the stress, and breathing exercise. So slow and deep breathing will help in reducing the stress level in the women, because they become very much stressed whenever they are in the postmenopausal period. So that is important, yoga and meditation and breathing exercise. Now, simple diet is very good for them, and plenty of vegetables, fruits, and with diminished fat and less sugar. It is important. There should be plenty of fluid intake, so to maintain hydration, and they should abstain or control smoking, alcohol intake, and tea and coffee. Next slide. Now, natural herbal remedies are also being used in some of the patients. Now, these herbal remedies are mainly phytoestrogen, black cohosh, progesterone cream, acupuncture. All these are natural remedies and some herbal remedies. But this efficacy data for phytoestrogens and black cohosh are insufficient. So, although it is used, we cannot say definitely for everybody, but some of the patients are getting improvement from using these natural herbs and remedies. Next slide. So we go for some medical alternatives also in some of the patients, because tibolone also we use in some patients. It is a synthetic steroid with weak estrogenic and progesterogenic activity and androgenic properties. So some get relief with this tibolone. Clonidine, that is an alpha-2 agonist, which helps with relieving the vasomotor symptoms, used in patients who are having treatment for breast cancer. We use SSRI to reduce the vasomotor symptoms in some of the patients. Gabapentin also reduces severity and frequency of hot flashes. Then progesterone may improve hot flashes, but there are concerns about the risk of breast cancer. So vaginal adhesive moisturizer also we use in some of the patients. Clonidine enhances the effects of anxiolytics and should not be used with alcohol. SSRI reduces 60% compared to 30% by acidic, that is the hot flashes are reduced. And gabapentin reduces frequency of hot flashes by 45% and severity by 54%. So these are as alternative medical therapies we may use in menopausal women. Next slide. Next slide. Now, plants use of phytoestrogen, as I have shown, this is, say, plants use phytoestrogen as part of their natural defense to control female fertility. So, but phytoestrogen, we are also using out of the phytoestrogen, these soya flavonoids and some, say, saponins and some lignans we are using. So, next slide. Now, isoflavone, most common form found in soybean, lentils, and chickpeas. Lignans found in beans, sprouts, and alfalfa, sunflower seeds, spinach, and clover. And humestans are found most cereals, fruits, and vegetables. Now, it has been seen, we have also used isoflavones, and isoflavone effects on hot flashes is very variable and inconsistent. So, and also it action starts a bit late. So, it may be used in some of the patients, but the results are not very encouraging. But only modest and delayed improvement of symptoms could be expected from black cohosh and vitamin E. So black cohosh and vitamin E also gives certain improvement in menopausal symptoms. Next slide. So if we say grossly, if we want to manage the menopausal symptom, management of a patient with the troublesome menopausal symptoms, so we have to think about the what are whether we will go for managing vasomotor symptoms or we are managing vaginal symptoms. So whether we are going for hormonal or non-hormonal treatment, and so depending on that, we will have to. So think that if the first we must evaluate the patient properly. So for managing the symptoms, so we must evaluate the patient properly and decide what form of treatment, and also discuss with them whether they will like to go for pharmacological or non-pharmacological agents, and we will have to provide them the knowledge about the menopause and its symptoms, uh, menopause and its symptoms. So like this, then we'll have to decide this managing vasomotor symptoms and managing these vaginal symptoms. So for managing vasomotor symptom, as we have discussed, we may go first for non-hormonal, non-pharmacological agents, and then we may try some pharmacological agents. And for managing vaginal symptoms, if the patient uh, if the patient is having, say, this coital problem, we may use either vaginal estrogen in some of the cases if there is no risk for breast cancer, breast cancer, I mean the breast and uterine cancer, or we may offer them this vaginal lubricant or the or anesthetic gel for prevention of dyspareunia and vaginal dryness. So likewise, this depending on the patient and their these symptoms and severity of symptoms, we'll have to decide whether we go for the non-pharmacological agent, pharmacological agent, or some vaginal local applications. All this we'll have to decide. Next slide. Now, in the medical herbs, with the following active ingredients, has shown some promising result. The herbs are Cyanesum wilfordii, Chlomis umbrosa. So from which we extract will be the cinnamic acid, wilfordii 45 milligram, S-methyl ester 41.79 milligram. So then the Angelica gigas 45 milligram. So these are the different composition and chemically. So next slide. Now this cinnamic acid, it is a natural remedy used for hundreds of years in both Korea and China, and has shown significant improvement in the quality of life for women dealing with the symptoms of pre, peri, and postmenopause. So a lot of people are taking in China and Korea with some reliable improvement. Now, Angelina gigas, it is this powder form normalizes ovarian hormone level and has anti-osteoporosis properties in ovarectomized rat. It is by this study by Gwen Kong et al. It is in 2012. And herbal formulation composed of combination of Cyanesum wilfordii, Chlomis umbrosa, and Angelica gigas have been used for treating menopausal symptoms. John Kim in 2017. Yes. So these reports and the publications, they show that they have got good result with the combination of these herbal medicine. Next. So evaluation of the effectiveness that those are combinations, we find this estrogen 100 tablet, we got those combination, and evaluation of effectiveness and safety of estrogen 100 on perimenopausal women for 1 year. This study has shown that there is significant decrease in the osteocalcin and significant decrease in the alkaline phosphatase in these women. So femoral bone mineral density also significant improvement in after this use of this estrogen 100. So improvement of bone health parameters is shown by this study. Next slide. So the result of the study shows that estrogen 100 for 12 weeks statistically significant improvement in quality of life. So that improved. So 9 different symptoms are improved: hot flush and night sweat, paresthesia, nervousness, melancholia, vertigo, fatigue, rheumatic pain, and vaginal dryness, pre, peri, post menopausal women. So this there is a very improvement very much improvement in these different symptoms, menopausal symptoms. And the important thing to be noted is that no adverse events were reported with estrogen 100. So estrogen was found to be safe and effective hormonal formula that can improve women's quality of life and various menopausal symptoms. Next slide. Next slide. Now that evidence shows and the study control subjects on estrogen group had significant reduction from 10 out of 12 permanent symptoms like this, vaginal dryness, hot flush, smoozing, like that. So all those symptoms were relieved. So relief symptoms within 7 to 14 days. So this evidence has shown by these different studies that the estrogen 100 has given a lot of improvement in the quality of life as per the Cooperman index symptoms. Next slide. So with this, I thank you all. I conclude my speech, and I thank the organizer and also all my viewers, to participants for their presence in this meeting.
Thank you very much, sir, for this nice presentation. Just give me 1 minute time, sir, to check the questions in our dashboard. Sir, one question. So there is, as the first line of approach is HRT to reduce the symptoms of this menopause. So always we should prefer, means practitioners should prefer this HRT treatment, or the means precautionary other treatments used to prefer for them, as there are lots of side effects on this HRT. What is the practical scenario?
Now, says if there is a then onset of menopause, like hysterectomy, sudden hysterectomy, or reduction menopause, those cases initially hormone therapy is best to because there is sudden sense to counteract this sudden sense. It is that hormone therapy will be estrogen and necessary progesterone therapy, combination therapy is important to relieve the symptom. But if it is, say, a gradual onset of menopause, in those cases, we may go for non-hormonal medications. And of course, some of the patients may need some anxiolytic, some other temporary therapy, not the actual hormone therapy, along with this, or supplements, some supplements may be necessary. So hormone therapy is a very, we must consider pros and cons of hormone therapy, and we must actually prescribe hormone therapy to those who are really needed, just like those say who are having premature ovarian failure. In those cases, we will have to give. That is a different thing. Those cases, or ovarian agenesis or dysgenesis, those we have to give definitely. Sudden hysterectomy patient we must give, particularly in the comparatively younger age. So those cases we must give. But gradual onset of menses, we should try for improving the quality of life, improving their knowledge about the menopause, and it is a transition period. It will not last for long. Gradually, they will get accustomed. Giving some supports for sleep, that means insomnia or mental disturbance, and food and exercise, all those things, we can improve their quality of life.
Thank you, sir. And another question is, sir, as hot flashes is the most common problem or most common issues. So for to reduce these hot flashes, what will be the ideal solution? What will be the ideal approach?
Now, for hot flashes, that means now non-medicinal, that means that is yoga, meditation, exercise, keeping busy with work, or having good discussion in a social platform like that. Those things help keeping busy. But even then, they may need some tranquilizer or psychotropic drug sometimes. And besides it, we can go safely for non-hormonal medications like this estrogen 100, like that. Those things also they are also giving. But only thing, action will start about after 2 weeks only. Then it can be maintained. But immediate, so if there is very severe then in those cases we'll have to go for even clonidine. Some of the cases we'll have to give for hot flushes. But we go step by step from simpler medicine to higher group of medicine.
Thank you very much, sir. And another very important thing, sir, in case of postmenopausal women, there is a problem in the calcium absorption, and there will be an arthritic problem also. So on that situation, means what is your practical experience regarding the prescription of this calcium supplements or something in the postmenopausal women, along with the other, means combating the other symptoms also?
Oh, calcium, see, in postmenopausal women, calcium absorption also decreases, and they will need, for improvement of calcium absorption, vitamin D supplementation is also important. So vitamin D supplementation along with calcium is important. That is, we must give. But besides that, we must encourage them to continue working and everything, so that bone activity will improve. And otherwise, if they remain sedentary habit and sedentary, that means this stiffness of joints, joint pain, these things will increase. So the calcium supplementation, vitamin D supplementation, and in some cases, maybe say even parathyroid supplement also become necessary. All we may give some of the patient if there is, along with osteoporotic, then alendronate or other.
Sure. Thank you very much, sir, for these nice deliberations. And I could not find any other questions, sir. So if you allow me, then we can conclude this session, sir.
Okay.
Thank you, sir. Thank you so much, sir, for sparing your valuable time.
Welcome.
Thank you very much, sir, once again for your valuable time on our platform Shield Connect. And in future also, we will look forward for some valuable